Hi and welcome to Physical Therapy TV. In today's video we are going to discuss rotator cuff impingement, specifically what you can do about it and what the symptoms are if you are struggling with it. Now, why does rotator cuff impingement occur? Typically it can be because of overuse. It can also be because of trauma that leads to inflammation and swelling inside your shoulder, causing impingement. It can be because of rotator cuff weakness, and we're also chronic poor shoulder position. This last one is actually what I really want to mention, because this is one of the leading contributors to a rotator cuff impingement, and causes that pain that you feel when you raise your arm, for example, overhead or maybe out to the side, and you get that sharp jolt of pain, like a deep type of a pain inside the joint. That typically is an impingement. There are specific tests that can be done for shoulder impingement, and a physical therapist or a doctor will be able to show you how to do that. But typically the symptoms, if you are struggling with shoulder impingement, could be pain. Specifically, again, if you raise it usually overhead or externally rotate your arm, you can experience some weakness, maybe even some popping inside your shoulder, and having difficulty sleeping on that shoulder. Typically, the types of shoulder pain, to just give you an idea, if you raise your arm up in specific directions and you can pinpoint the pain in a specific location, that could be an indication of an impingement or a rotator cuff tear. Typically a tendonitis or bursitis would be just palpable tenderness to the shoulder area, whether it be in the front, the middle, or the back. Those dots you see right there in the video pretty much indicate specific muscle tendons of the rotator cuff. So if you feel pain in those areas when you just push on it, might be a more a tendonitis compared to a tear, but a tear can still to some extent present with palpable tenderness. Now, the treatment, there's a couple of things you can do for rotator cuff impingement. Firstly is to end the rotation, whether it be the habitual chronic position of your shoulder. I included this picture specifically to show you where your shoulder is hunched and the arm is sort of jammed up into the shoulder joint. Typically of our lifestyles today, where we sit a lot, we drive, we sit at a desk, our shoulders is in a chronic poor position, and the muscles in the front of the shoulder get short and the muscles in the back get lengthened. Combined with that loss of range of motion, weakness in the muscles occur, which leads to all sorts of shoulder problems, including tendonitis, impingement, and eventually a rotator cuff tear. Exercises that you can do would be a doorway stretch. Very simple. Just as it says, you find a doorway. You can do it at 3 levels with your elbows down, below the shoulders, shoulder height, and also above your shoulders, depending on the pain. Again, you got to clear these exercises with your doctor, but with one leg out in front, one leg extended in the back, you just gently lean into that stretch. Should feel comfortable. You can hold it for about 10 to 20 seconds. You can do that as many times as you want throughout the day. That should start stretching the shoulders back, improving the flexibility of your chest muscles. Another good exercise to work on the strength of those muscles that pull the shoulder back and put it in a better position would be an elastic band external rotation. Just find an elastic band, tuck your elbows into your sides, and just gently pull both arms out to the side. You can do that 10 to 20 times, 2 to 3 sets, a couple times a day. Over time, those 2 exercises can definitely help for a rotator cuff impingement. We do offer some more helpful tips. You can check out the link below this video or go to theshoulderreport.com. We have some free tips and information for you there. Again, thank you so much for watching, and we'll speak to you soon.